In 2018, I was looking for a new challenge, and my wife and I wanted a place that we could call home. We interviewed in a few different spots, and we felt like this was, number one, the nicest place in terms of the people. We felt my colleagues would actually be very nice and very friendly and cordial. And we were looking for a town that had things that we wanted. We wanted a Costco, we wanted an airport that if we wanted to travel, we can get anywhere we wanted. And so that's what kind of attracted me to the area. And then when I came, I just loved the people that I interviewed with.
When the job came available here, it became very clear that Lubbock was a really fantastic place to live, and in particular to raise a family. And we have 2 little girls, and we have a great neighborhood school that they go to. We actually walk them to school.
I think what I love about Lubbock is it's kind of the best of both worlds. So, it's kind of a smaller community. I can get from one end of town to the other in 15, 20 minutes. There's not a lot of traffic. But at the same time, I feel like it has all of the amenities of a big city. So we have, the big university here with Texas Tech. There's a medical school, there's a law school, there's all the ancillary schools that go with it. There's a theater, there's a ballet, there's an orchestra, there's the Division I sports that are really accessible, and pretty much anybody in the community can go.
When you think about the American dream, I think about Lubbock and my kids being able to roam around and play and have fun, and the cost of living here is super low, which is great too, because it allows us to also travel a lot, allows us to do a lot of things that we maybe wouldn't be able to do when we've lived in other cities like New York or Boston. But ultimately, I like that it's just a family feel. It's a family town that I've really come to love.
Being a little bit of a smaller community, the hospital is so important. Being able to provide medical care here and doing it well with quality physicians and quality care is really important. And I feel like when you come to a place that's a little bit smaller, you can really make a difference.
UMC, it's outside, if you look at it, it's a county hospital, but it's managed really well. It's 500-bed hospital, and we have all kind of service lines here. We are a major teaching institute for Texas Tech School of Medicine, and we serve the area of surrounding area of about 1 million people of West Texas and eastern New Mexico.
There's not a major medical center within about 300 miles around Lubbock. It's so tied to the community, and it's so important for the vitality of the community that UMC's here. And so it makes you want to be a part of that.
UMC is such an amazing hospital, and that people actually choose to come to UMC. It's not something that they feel like they're forced to do. There are lots of patients who get all of their care from UMC physicians, including my family. My kids go to a UMC pediatrician.
What really caught me off guard when I got here and it kind of got ingrained was the culture of the institution. You really don't see that other places. I mean, it comes from the top all the way to the bottom. You see people that want to help you, that they want to do the best thing for the patient. They're always looking how to improve patient care, how to improve doctor satisfaction, how to improve everything in the hospital.
It's the people. UMC has one of the best staff. Physician, nursing, and sports staff is amazing, and the administration is really involved with their staff, and we have one of the highest employee satisfaction surveys in the state.
UMC, I think, serves a very unique role in some ways as, it's a teaching hospital, but also serves a lot of the population of the community that ranges anywhere from indigent to trauma and very acute care needs to all kinds of elective surgery for private patients. So there's a lot of people around to help care for the patients. And so I think that's one of the advantages actually of UMC is that patients have a lot of people looking after them at any one time.
This is a county hospital, but we have cutting edge everything. We have 3 Tesla scanner. I mean, in radiology, that's the top thing. We always are buying new scanners, new equipment. The administration really wants to help us become the premier imaging institution in Lubbock, and we are. And they're committed to keeping us that way as well.
But our hospital administration is in our units every single day. They're talking to us, they're asking us, hey, what do you need to do your job? How can we help you make your job easier? We kind of went and said, hey, UMC needs to really beef up their children's services. They're like, yeah, you're right. The community doesn't even know we take care of children here sometimes. So over the past probably 5 years, that's been a big push, and you see UMC Children's marketed everywhere. The services are beefed up. We can probably provide 90% of care here without having to send those kids someplace else. Children's Hospital probably, I would say, every month has a community project or a community event. So whether that's back to school night and making sure kids have backpacks with all their supplies, kind of a backpack drive, water safety in the summer. They have kind of a focus on the family event where they have a big game night at, one of the gaming places here in town. So we're a Children's Miracle Network hospital, which means, the community raises a lot of money for us. So we have a telethon every year, and the amount of money that the community just openly gives to the hospital to support what we do, it would blow your mind, the stuff that they've been able to finance for us. So I think UMC appreciates the importance of the community to them, and they are constantly trying to give back.
I look at UMC as a leader. No matter what facet, if it's volunteer work, they're out there volunteering. If it's setting up COVID testing, we were the ones who did that here. If it's a new thing like a drive-through clinic, the first one in the state of Texas, that's us. We really are a leader in this community and in the greater area.
It's really cliche to say, I always hear people talk about when they get a new job, like, oh, it's my dream job. But as time has gone on, I don't want to go anywhere else. I really have enjoyed my growth here. I've really enjoyed my relationships here with my residents and my attending colleagues. And Lubbock itself has been a fantastic place to live, so I don't ever want to leave.